Hi, my name is Ella. I'm an OBGYN resident and I'm also a runner. Today I want to break down some of the research behind some of the most common gynecologic problems that runners face, and I'll be using different parts of the literature to explore each of these not often talked about topics. The first topic I wanted to talk about was chafing. A retrospective cohort study of 719 Portuguese trail runners found that skin irritation and chafing accounted for about 14% of all running related injuries. This makes it one of the most common running related injuries and in the top 5, with other injuries including chafing, ankle sprains, and iliotibial band syndrome. So, there's a lot of interesting components that can cause chafing or contribute to it. A 2024 review from the Journal of Athletic Training challenged the traditional role that chafing and blisters are simply caused by surface rubbing. The authors argue that it's actually more of a shear deformation, meaning that the deeper layers of the skin are being distorted by bone movement against a high friction surface over and over again. That's a fundamentally different mechanism, and it changes how we think about prevention. One review in a journal called Materials examined the interaction between skin and textiles. They found that the friction behavior actually gets worse when you have moist environments, and that it increases the moisture coefficient of friction, meaning that the moister the environment, the higher the friction was on the clothes. So wet clothes was accelerating for chafing. So the evidence has a couple key takeaways. The first is that moisture-wicking fabrics reduce the friction coefficient, and anti-chafe barrier creams like petroleum jelly reduce those shear forces. This overall can prevent chafing from happening. Additionally, doing things like minimizing seams on clothing can also help. And this is especially important in areas like the vulvar area. The thing I wanted to talk about was vulvovaginal candidiasis, or yeast infections. One systematic review in 2018 in the Lancet Journal of Infectious Disease found that about 75% of women do have at least one yeast infection in their lifetime, meaning that it's one of the most common conditions. So how does this relate to running? One cross-sectional study of women of reproductive age in China used a multivariable logistic regression and identified that increased frequency of wearing tight clothing was an independent risk factor for developing a yeast infection. Their odds ratio was 6.6%, with a confidence interval of 1.4 to 27.8%, meaning that there was a significantly increased rate of yeast infections amongst those who used repetitive, tight clothing. The proposed mechanism is that tight clothing promotes friction and maceration, and that increases the local acidity of the environment, therefore increasing the risk of yeast infections. The clinical implication of this is that for runners, it's important to change out of sweaty and tight gear promptly and opt for more breathable fabrics. And we also recommend avoiding vulvar irritants like perfumes or things like that would cause more breakdown of the skin and potentially more acidity. The third thing I wanted to talk about was UTIs. There was one landmark randomized control trial in JAMA Internal Medicine Journal in 2018, which took 140 premenopausal women who had recurrent cystitis, meaning that they had more than 3 episodes per year. They compared the rates of cystitis for individuals drinking less than 1.5 liters of water per day to those drinking more than 1.5 liters. Over a 12-month period, they found that the individuals who were drinking more water only had 1.7 episodes of cystitis compared to 3.2 in the control group, meaning that there was a reduction in about 50% for these individuals that increased their water intake. The mechanism of this is that increased urine volume dilutes and flushes urogenic bacteria, meaning that there's less adherence to cells and less infections. Running specifically, it means that there's a combination of factors, including dehydration from sweat loss, repetitive injury and friction from running itself, and prolonged urinary retention from running long distances. And the evidence-based approach suggests that runners should really hydrate before, during, and after exercise, and plan routes with bathrooms available. There is another category of issues that lots of women face that are more related to pelvic floor concerns. So one condition called stress urinary incontinence is very common. It's found that female athletes are 3 times more likely to experience stress urinary incontinence than sedentary women, with a prevalence ranging from 11 to 80% in high-impact activities like running. One Cochrane review demonstrated that pelvic floor physiotherapy can result in a cure rate of 76%, compared to just 9% with no treatment. So this is really high-quality evidence that pelvic floor physiotherapy or strengthening your pelvic floor may really help with this condition. Finally, another topic that's really important to consider when talking about female reproductive health and running is the relative energy deficiency in sport. There's a lot of research out there that suggests that there's a lot of impacts on decreased energy intake during high-intensive activities that can impact your hypothalamic pituitary gonadal axis. This can disrupt things like your menstrual cycle, and is a reason why some runners may struggle to maintain their menstrual cycle during running. It's really important that you talk to a nutritionist about this and make sure that your energy expenditure matches what you're intaking. If your periods become irregular or stop, that's not necessarily a good thing with training adaptation, and it's something that you should look out for. All of these issues are common. They affect lots of individuals and lots of runners specifically. So don't let embarrassment keep you from addressing them. There's a lot of research out there that may support you in your running journey.